This 3-year-old dog, Moses, has spent most of his life walking on a leash.
They did let him off once, and he was running and he turned a certain way and he threw his knee out.
Paula Meadows took Moses in for a checkup and learned her dog has hip dysplasia.
What happens is the cartilage erodes away, and then the bone just begins to scrape on itself.
Then they let us know that he probably would need 2 hip replacements on both sides.
This would have cost $10,000. So when Western Veterinary Clinic said it could perform stem cell therapy at just over $2,000, the Meadows took them up on it.
We take some fat tissue or adipose tissue from their body. It could be done from the shoulder or from inside the abdomen. And we put it through a process of enzymes and solutions to isolate and release the stem cells that are stored in that fat tissue.
After the stem cells are activated, Dr. Chris Persing injects the cells into Moses's hips.
Once the stem cells reach their target location, then they're able to differentiate into whatever cell needs to be made at the time.
This cutting-edge surgery saved the Meadows time and money, but gave them much more.
Cutting edge, all that stuff is great, but to know that your dog is going to be fine.
And by the look of things,
he's just so happy, and I think you noticed he actually did a little jump when you came over, and he hasn't jumped since he was probably a year old.
Moses's dog days seem to be back, minus the leash.